Hi, this is Dr. Randy Bach. Today is March 25, 2022, and I am speaking from beautiful Napoli, Italy, Naples, as we would say. And we just arrived earlier today on an overnight flight from the United States. So I've got some experiences, regarding air travel. Fortunately, no masks were enforced on the international flight. Italy still requires it on public transportation. My quick observation is that, oddly enough, the mask usage seems to be bipartite. They're concentrated in young people and old people. I get the old people part a little bit, but there's was really a high contingent of college age kids traveling to Italy on vacation, whatever, end of the school year, wearing masks. I think this is part of their college, you know, indoctrination. The root word of doctor is in fact is teacher, like orthodoxy, doctrine, indoctrination. So they're getting taught something and they're acting it out. I met a fellow Yalie. He's entering his junior year, I guess, on the airplane. I mean, he's not entering the junior year on his airplane, but I met him there and we chatted very briefly. He was not wearing a mask, but I asked him how college had been, and he said it was really kind of bad, especially the first COVID year, and this one's a little bit better. He's hoping for better still in the following year, that it was not really the convivial, no pun intended, collegial college-like experience that he had been expecting. Hopefully it got a little bit better in Italy. In Naples, there are very few people wearing masks at all, if any, frankly. And Naples is kind of like the real Italy. Rome, somewhat like going down the Venice route of being, kind of over touristed, but obviously Rome has, state government and the Vatican, all that kind of stuff. There's a fair amount of business there, but for the most part, people are getting around doing things without masks, and they're not dropping like flies, from what it seems. As far as the workers, the flight attendants, some wore masks and others did not. Hopefully, some of this, will stop, but for people who want to continue wearing masks, they're going to continue wearing masks. I have to look into this, and maybe we'll cover it on a later broadcast. But a lot of what we've seen from the data for, quote unquote, long COVID, it may be something along the succession of mystery illnesses like fibromyalgia and, Epstein-Barr virus, chronic fatigue syndrome, which don't have a firm cause, but may be correlated in part with depression and other issues such as anxiety and whatnot. But again, that's another day, another time. Ditto monkeypox. I'm imagining with the first word monkey that it hasn't been a huge human illness to date, likely won't cross over. I'm also imagining that it's somewhat exaggerated, and from what I understand, it's happening in kind of sex bathhouse or rave party scenes in Europe and the United States. So keep it zipped, keep it checked in, try to maintain sober, moderate behaviors. Historically, there's a reason for those. They tend to correlate with longer term success across the board. So riskier behaviors lead to riskier outcomes potentially. So I'm going to kind of get right to it. I was fortunate enough to attend a lecture earlier this week through Zoom, given by a professor in India. And I'm going to put him up on the slide so I read his name appropriately. His name is Bhaskaran Raman. He's a professor of computer science at the Department of Computer Science Engineering at the India Institute of Technology, Bombay, which is akin to say India's MIT. And he's not a public health expert. He's not a physician. He's a smart guy who deals with numbers and computers and algorithms, and this is what he came up with. So it's age-wise excess deaths analysis in U.S. and Europe in 2021 and 2020, and he, aside has implications for India, but we'll probably go light on those. So I don't want to spend too much time on this, but this here's basically where he got his data from, the main sources, and you can get the same data yourself. He's got available slides, such as I obtained them right here. And he's got a few caveats that you can't draw from conclusions. These are just population-wide statistics and there are a lot of other things going on potentially. So let's first look at the United States. Fortunately, we've been able to divide the data out by age group, although we don't always see it immediately. We don't always see full data for 2021. And this is non-COVID deaths, pretty much represent the entirety of deaths in this young age group. And the very few overall, and as a proportion of the COVID deaths, I think your risk factor at this age group is about 10, 15 times less than somebody in his 80s. So since throughout the years, these are the kind of the pandemic years, 2020, there were no excess death or emergency cases in this age group. So why give universal medical intervention, the quote unquote jabs, and or mask them? This is not a group that really is engaged in the COVID pandemic at all. If anything, it's just an irrelevancy. So, why we keep masking kids in New York City? They're still masked up. A lot of places else, they are still masked up. So there's no real point in this. And why were they given injections when we can't look at long-term data? So this is a huge slide with great implications, which seemingly have not filtered out the population. Getting back to my airport travels and travails, a lot of kids were being masked up at the airports and whatnot. Good luck to them. Their parents maybe should watch this presentation. Excess deaths in the United States in the teens, 15 to 19 years old, saw some increase, but not really from COVID. The non-COVID deaths went up. So what's the deal with that? Well, lock people down, get them depressed, and who knows what can happen. There have been huge numbers of fentanyl deaths, and there's been an increase in opiate deaths, and certainly this coincides with this age group here, 15 to 19. And obviously, when this age group is involved, they have more loss of life years than somebody dying at 80, 85, 90, etc. So this kind of carries on the same trend, going up a little by small increments. So I'll kind of pass over the slide, but the same basic idea, a little bit more COVID deaths. But overall, most of the damage to this age group, which, mind you, hugely outnumbers the 85 plus and the 80 plus age group demographic, and we'll get to that a little bit later. So non-COVID, lockdowns and changing society, getting people out of schools, giving people, quote unquote, leisure time. What does they say? Idle time of this devil, idle hands of the devil's playthings. This seems to have caused some issues across the board, and we're still in the young age group. Same basic thing here into their 30s until age 40, and continuing. As you get older, there are more excess deaths from COVID, but still predominantly non-COVID. And so, just in case we're not clear on this baseline here, these are the prior years, and we see this pandemic years causing excess deaths. So that's kind of a finite measurement of COVID problems. So here now we're getting to COVID in age 50 and above. There's still some questions which he brings up over here. Between these 2 years, why has COVID excess deaths and overall deaths increased despite the vaccine? So here we have vaccines. And things, have they gotten better? The viruses have gotten less virulent, less deadly, and nonetheless, the numbers have not decreased from COVID-related deaths. In the United States, it's difficult to say because we attribute a lot of deaths to COVID that are not dead genuinely from it. We test everybody in the hospital, so there's a lot more testing going on. So it could be that things that are happening coincidentally, you have a pancreatic problem, but they test you for COVID, they attribute it to COVID. Or you die from fentanyl overdose, they test you for COVID. So we're getting a lot more cases. So I think a lot of this is confounded in the US because we're over testing and getting a lot of other things confused with non-COVID deaths. But at the very least, the presence of the vaccine has not really dropped COVID deaths very much at all. You can see in this age group, we're getting a little bit older. COVID deaths actually increased despite the presence of a vaccine. And again, in the face of a less virulent virus than the ancestral 2019 version itself. So this carries forth across the board. We're pretty much the same trend. We finally start to notice a decrease in overall deaths as the older age groups come up, 70, 74, and we're in late 70s. And likely these numbers are going down. There are fewer COVID deaths because probably the ones, the dry tinder, the people who are really on the edge, likely to die, in precarious health from comorbidities, they died in this year. So you're not seeing as many of them dying in the next year. So there's probably benefit from vaccine here. So it's maybe a combination of vaccine and fewer sick people to die in these age groups. So arguably, if you want to, if you're a vaccine kind of guy, you want to push vaccines, you can make your argument that, say 70 and above, that's possibly a reasonable thing. The professor Rahman makes the note that this really hasn't decreased that much despite the high levels of vaccination in this age group. So here is probably your greatest success, 85 and plus, and above. So you're talking about the very, very old, which represent a tiny fraction of the U.S. population, and for these people, there's probably some benefit. But being careful around elderly would have pretty much covered this without cutting into society, printing money, causing inflation, cutting down people's education, their capabilities, their marriages, life in general. So this was all pretty much of a farce. The way it was executed, draconian measures for everybody, when really the only age groups that can be seen to have had benefit at all are the advanced elderly, and that may not even be from the vaccine per se or the lockdowns per se, but for the fact that a lot of them who were going to die from COVID. Now, if they're that ill, probably would have not necessarily lived the year anyway, but maybe there would have been more kind of carried over to the next year. So here's all ages taken together, and these kind of mimic the ones from the older age groups, these charts. You can see the last few charts. This last chart, all ages, pretty much looks like that. And the reason is because the young people don't die. So their numbers look interesting compared to young people, but because they don't really die at all, they're not going to factor into this death ratio presentation. So let's analyze why or what is happening in the United States. There's been, and this is red line is 2021. For some reason, the data stops in July, and this is the CDC, your tax dollars hard at work, and they can't come up with the data for the last half of this year. I don't know whether they're suppressing it or what. It doesn't really seem to make a lot of sense. But even in 2020, the natural cause death rate didn't go up, but here somehow it is. The difference between 2021 and 2020 is this year, pretty much everybody's vaccinated. All of a sudden, quote unquote, natural causes are going up. Is that vaccine related, or is it related to depression, bad economy, drug overdose, etc.? Hard to say. But this is young people here, and probably it's a combination, whether it's the vaccine or misery. I don't know, but certainly they're taking a toll. And again, they lose more quality adjusted life years than somebody in his 80s. Same thing's happening as we go through these similar age groups. We see the same basic problem, but it tends to go out. So he summarizes these excess deaths in the United States with these questions. Why is the non-COVID excess far higher than COVID excess in most of the younger age groups? And again, I think we can somewhat answer this, that misery is not good for the human psyche. When the human psyche is not healthy, it doesn't do well. And again, this age group is far more likely to die from kind of self-inflicted drug death and so forth. Why is there such a high non-COVID excess in almost all the age groups? I'm not sure the answer to that. But again, probably same basic thing carrying over. More drug overdose. There's probably been some postponement in examining, diagnosing, treating cancers and so forth when the hospitals were, kind of cowering under the potential burden of coronavirus issues. And let's see, from going from 2020, we'll skip to point 4 here. Why has COVID excess increased in most age groups, especially the younger ones, despite the jabs? Well, this is in a sense begging the question, because it may not be despite the jabs, maybe because of the jabs. So, it could be that, having a COVID vaccination makes you, get sicker from COVID. I mean, who knows? And then why is natural cause death skyrocketing for the younger age groups in 2021? Why is the data missing after July? So those are his questions. I think they're reasonable questions. If you want to get on the CDC and ask them any of these questions, please go ahead and let us know. So now he looks at the European data, and I think this is reasonable because Europe doesn't have the same financial incentive across the board, either the patients or the hospitals, to create or document a coronavirus diagnosis such as we do in the United States. Hospitals get excess payment if COVID diagnosis winds up in the ICU. They get, I think, $13,000 extra per case. People have had their deductibles eliminated if there's a coincident COVID diagnosis. I don't think that's the case in Europe. So, as with the United States, there really are no excess deaths for young people. If I take that back, I'm not sure. I mean, we might have, I guess, in this, this is the pre-drug using age group, 0 to 14, and so they had fewer deaths, maybe because here they're locked down, they're not dying in bicycle accidents or car accidents and stuff like that. So maybe the lockdowns helped prevent some deaths, but also prevented a lot of life in general. So his question here, since there's no excess death, why are universal medical intervention, the vaccination jab recommended for them universally, and of course, why are they wearing masks, etc. Here we get into more of the drug using group, 15 to 44, and we see there are excess deaths in 2021. But in 2020, the pandemic year, they didn't have any excess deaths compared to prior years. So this, again, this is your bulk of society under age 44, and we'll look at the population pyramid a little bit later. But basically, they have no benefit from, they had no deleterious effects from coronavirus at all. So the whole shutting down society and going nuts over this was not really evident in any change in health for the vast bulk of your younger population. And clearly, there's a residual problem here, and there's many as 4% excess deaths in Europe. And this is, again, probably drugs, problems of disease of despair or postponed diagnosis or whatever. So the pandemic has had its problem, but not from the coronavirus, but from the way we overdid our response to the coronavirus. Now, as you get in the older age groups, you start to see some actual excess deaths from presumably COVID here, 2020. But again, you see more of it in 2021 for the reasons I've already mentioned. As we're getting older, finally, at this 75 and above group, we see that COVID was more deadly than COVID with a vaccine. So this is COVID with no vaccine, COVID with a vaccine. He asked kind of the negative question, which is why is it still this high despite the vaccine? So the vaccine may not be doing that much in general in preventing overall elimination of excess deaths. So here we finally get the creme de la creme, the 85 and above, who did have a bad year in 2020, relatively speaking, compared to the other age groups. They got some benefit from the vaccine. This is probably an entirely vaccinated group, but still they're showing excess deaths from COVID. Excuse me, not from COVID, but in general, and presumably from COVID. So again, once again, these death graphs, bar graphs, mimic the older age groups because that was the your dying population in general. So he goes over monthly excess deaths in Europe. This is younger age group, and in light is 2020, and in red is 2021, and almost across the board, there are more excess deaths per week of the year in 2021. And this is, again, at a time when pretty much everybody's getting vaccinated. So the question here is whether people dying more because of, in these younger age groups, because of vaccination or because of misery, drugs and so forth. In almost no time did they do worse during the COVID year, except for the, I guess, phase one over here, week 13 to 16. So that's the March, April time of year. Here's your COVID. This is it right over here. You're looking at it. Phase one is the, pretty much only dangerous time. And again, for the older population, 45 to 64, there's still significant numbers of these people. And if you make any argument for closing society down, all this stuff, this is the blip you're talking about. But almost across the board thereafter, there are no differences, and even probably slightly worse with the vaccination time. So people were getting vaccinated in January of 2021, and all of a sudden the number actually went up. And for a few months after that, the number of excess deaths were higher in this older age group in 2021 post-vaccination, it seems. So there, you can figure out what this has to mean. The age groups go ahead. Similarly, we see the same thing. This is really your pandemic year, 2020, March, April. And that's the only time of all these months for the last 2 years that COVID deaths exceeded the one from the following year. Let's say the only time at which the unvaccinated group did worse than the vaccinated group, presuming that 2021 is vaccinated and 2020 obviously could not have been. So he has some similar questions for these, and I'm going to leave this slide up. You can read this on your own. You can just pause this. But the real questions, I guess, I've said here and before, is similar to the United States in a lot of regards, that the vaccination did not really seem to change much in excess death. In fact, in every age group under 75, excess deaths have increased from 2020 to the following years, despite the vaccinations, and perhaps because of the vaccinations. Or if not because of the vaccinations, because of drug overdoses and whatnot. Who knows? Now here's questions comparing the United States and Europe. The U.S. has a huge non-COVID excess for the same age groups and the younger crowd. Why is that? I'm not sure of that answer. Maybe somebody could help me out with that one. It's not obvious to me. Let's see what else we have here. Numerically, the excess death, including COVID, for any age group in Europe is about 12 to 15%, but in the United States, just the non-COVID excess is far higher in younger age groups, a staggering 30 to 35% in this young middle-aged 30 to 44 age bracket. Why is this not receiving twice the attention as COVID? So again, this is probably disease of despair, which ultimately will far outweigh the COVID issue. But we're not we're not calling it an opioid pandemic. We're not calling it a depression pandemic. We're calling it a COVID pandemic, but this is wrong, except for the elderly age groups. In both the United States and Europe, COVID excess deaths in 2020 was within statistical variation for the under 40 age groups. Why were there? So for everybody under 40, COVID was no worse than any other prior year. So to say it had no significance at all. Why were mass medical interventions such as vaccinations in this age group, as well as masks and limiting movement and so forth? In both the United States and Europe, for the under 15s, excess deaths in both 2021 don't really show much at all. Why do mass vaccinations for this age group? So he goes over possible causes for these issues, possible causes of non-COVID excess deaths, lockdown-induced effects, what I mentioned here, deaths of despair, lack of other medical care, vaccine side effects. So this is an important slide, and I'd like you to ponder this. Possible causes of higher COVID excess deaths in 2021. It could be the vaccine is less effective. It could be the virus works differently for people vaccinated. some of these kind of biologic evolutionary pressure on the virus. I'm going to probably skip over this slide a little bit. I'm going to just kind of go over some. Let's see if I can find it here. I think I have a graph here just to show you the relative risk between a 50-year-old and anybody else. So I made this graph a while ago showing the risk of death from COVID in a 50-year-old versus any other age group. So this is the older age groups over here are literally, a 90-year-old is 40 times more likely to die from COVID, an 80-year-old 15 more times, and then the other numbers get, vanishingly less likely. So if your 50-year-old is, kind of getting old in a way, the older age groups are far more at risk. Yet we didn't focus our attention to those age groups. These are the data at the time. I did this, I think, in late 2020. But somebody in a teenager, let's see what age group this is. So 5 to 14. So if you're between 5 and 14, you're about 12,000 times less likely to die from COVID than an oldster. And these numbers kind of go across the board. Similarly, 1,000 times if you're in your 20s, and then hundreds of times less likely as you get older. So let me just kind of pull out from this slide this. And anyway, I'm going to keep this pretty much short and sweet. I'd like you to look at the slides, think about them. But this was a little bit of a non-event, and you have to take what public health people say with a little bit of grain of salt and more. We have really done damage to our society, our social institutions, and so forth for a virus that, in a sense, mimicked what a flu would be if we didn't have a prior vaccination for the given flu strain. So let me know if you like this, if you want to have any other topics you want me to discuss as time goes on, and I look forward to talking to you. Thanks so much for